The incidence of breast cancer just keeps going up, and with the rumors we keep hearing more and more about turbo cancers popping up and even younger women than we're used to seeing, I think now is the perfect time for us to discuss the earliest signs and symptoms of breast cancer so you can be on the lookout for these and take appropriate action as soon as you see one of these signs or symptoms. I'm Dr. Ken Berry, a family physician with over 20 years of clinical practice experience. Let's talk about the earliest signs of breast cancer. But first, a little information. Why do you want to catch breast cancer early? I mean, it makes good common sense that you'd want to, but here's exactly why. So there are 4 stages of breast cancer. You want to catch breast cancer at the earliest stage possible for this reason. Here is the survivability, and so basically how likely you are to die if your breast cancer is diagnosed at a certain stage. And you can see with stage 1 and 2, the survival is pretty darn good. But as you develop stage 3 breast cancer, or especially stage 4, the survivability of this goes down drastically. So that's why you want to pay close attention to these earliest signs of breast cancer and seek medical care if you see even one of these pop up. One of the very earliest signs of breast cancer is a lump or a mass that didn't used to be there, that's now there, either in your breast tissue or in your armpit. So breast self-exams, the research about whether they detect breast cancer earlier are a bit equivocal, but it's such a low cost, it's easy to do. Every time you're soaping up in the shower, you can do a breast exam on both sides, but don't forget to also feel in each armpit, each axilla, because if you have an early breast cancer, then that's going to be draining to one of the lymph nodes under your arm. And so make sure and do a thorough breast exam each time you're in the shower or the bath. The soap makes your fingers glide more easily, so you have a better sensitivity. If something's been there for years and years, then obviously that's nothing to worry about. But if you have a new lump, either in the breast tissue itself or in the armpit, you need to go see your doctor and get that investigated. The next is a change in the size or shape of the breast. And this will be just one breast. All of a sudden it's got a little different shape, or it's a little bigger than it used to be, or just any kind of shape change or size change that needs to be investigated. Now, there are many things that can cause this. Obviously, the most dangerous one, and the one you want to rule out, is an early breast cancer. Another very early sign of breast cancer is any changes in the skin of the breast. So if you see any dimpling, any puckering, if it starts to look like the peel of an orange, or if you start to notice any scabbing or crusting or roughness, like a rash on your breast. It could just be a rash, but it could also be an early sign of breast cancer. Get that checked out. Another very early sign of breast cancer is changes in the nipple. So the shape of the nipple, if it starts to invert or turn inward, that can be a sign of breast cancer. If you have any discharge, any new discharge coming out of one of your nipples, you've got to get that checked out by a doctor. Even more concerning sign is if you have a bloody discharge from one of your nipples, that has to be investigated by your doctor. Now, this is not a guarantee that it's breast cancer. There are other things that can cause that, but the chances of breast cancer go up if you're having nipple discharge or changes in the size or shape of your nipple. That needs to be investigated. Another less common but yet possible sign of breast cancer is breast pain. Now, most of the time, breast pain is not caused by breast cancer. Typically, breast cancer is painless. But there are some forms of inflammatory breast cancer that will cause pain in the breast. And so if you're having new onset breast pain, that must be checked out by your physician. Now, the most common sign or symptom of breast cancer is no signs or symptoms whatsoever. And that's why we recommend that about the age of 40, you start having a screening exam. You can talk to your doctor about whether you want to do a mammogram or whether you want to do an MRI. Both of these are very sensitive for early breast cancers. Thermography, although it's good at detecting bigger cancer, which is typically a later stage of cancer, they're really not good at detecting stage 0 or stage 1 cancer. So I don't recommend thermography for early screening. But about the age of 40 or 45, you need to talk to your doctor about getting screened for breast cancer by one of the imaging modalities. I have other videos on this channel about what breast pain can mean and also breast cancer prevention strategies. I'm going to put links to those videos in the show notes. Keep in mind that breast cancer, if caught early enough, can almost always be cured and you can be cancer free. But if it gets to stage 3 or stage 4, your chances of being able to say that you are a breast cancer survivor go down a lot. So look for these signs and symptoms and go see your doctor if you have any of them. This is Dr. Berry. I'll see you next time.